Good day to you all. My name is Dr. Ebeande Kutawanje. I'm a clinical oncologist with the NSI Youth Cancer Center. Today we'll be having a short discussion on colorectal cancer. So, what is colorectal cancer? Colorectal cancer is the most common GIT cancer, the most common cancer of the gastrointestinal system. Now, colorectal cancer has been a disease that's been with us for a long time, but recently the numbers with us in Africa and Nigeria has begun to increase. This is because of the advanced mode of testing. Tests are being done to detect this disease early, and treatment options vary and abound around us. Colorectal cancer is the 5th most common cancer worldwide. As I said earlier, here with us in Africa is emerging and is about the 3rd that we have across both sexes. So you ask me, what are the risk factors for this cancer? Now, the risk factor for colorectal cancer, as with all other cancers, are 2, broadly divided. There are those ones that we can modify and the ones that we cannot modify. The ones that we cannot modify are those ones that are genetically related, genetically linked. These are cancers that are found to run in families. So when a father has it, an uncle has it, it can be passed directly to the son or the children, as the case may be. And these are the cancers that particularly are found in earlier ages, 20 years, 30 years of age, because colorectal cancers, as with some other cancers, are usually found in the 6th or the 7th decade of life. So when you're finding these cancers in younger age groups, then it's most likely something that has to do with a genetic disorder. Now, other factors that could bring about these colorectal cancers would be broadly divided into lifestyle and diet. Now, lifestyle has to do with alcohol consumption and cigarette smoking. Then every other social behavior that could predispose you to this. But top of those lists is alcohol consumption and cigarette smoking. Now, diet is one major risk factor that predisposes to this. So we have a lot of processed food these days. We have a lot of quick fix meals these days. And these meals could easily, papers have been published to show that these meals could predispose people to colorectal cancer. Having mentioned that, I also need to mention high fiber diet and high residue diets. These are diets that form a lot of bulk and help stool movement and predispose less. They do not predispose to colorectal cancers. In a sense, what we're saying is the fact that high fiber diets and high residue diets are protective against colorectal cancers. Now, one of the issues that I still need to highlight is the issue of lifestyle that has to do with sedentary living. Exercise has been found to be a very good way of limiting the predisposition to colorectal cancers. By exercise, we mean that you have to burn fats and you keep your organs active. In the same vein, you also realize that fasting, whether intermittent or a long fast, would also help in limiting the risk of having colorectal cancers. I hope that with these few issues that we've been able to raise in this short discourse, you've learned 1 or 2 things extra to what we know about colorectal cancer. Thank you.